This is the 3 degrees of an injury and anatomical failure. So it's the 3 degrees of an injury and anatomical failure. So watch how this goes. The first degree of an injury, subthreshold. What does that mean? The quantity or quality of injured cells do not affect the signs, symptoms, or functional capacity. Mostly, no need for care. Sensitivity of bowel markers is real important. This was what I said to you. I said, I got scar tissue here. Is it an impairable rating? Is it? No. How does it affect sensory? No. Motor? No. Gross range of motion? No. It doesn't, does it affect my ADLs in any way? No. But it's scar tissue. It's called subthreshold. That's what subthreshold is, okay? Second degree of an injury, functional capacity. The quantity or quality of injured cells affect functional capacity, meaning your range of motion, your strength, your sensation, sight, feel, hear, taste, smell, your bowel markers, whether they're subjective, objective, quantify. Sensitivity of testing is important. Mostly require treatment. 3 phases of healing are vital for the full return of functional capacity. So when you have the second degree of an injury, and that's most of the injuries you guys see, you definitely need treatment, and the patient's going to go through 3 phases of healing. Because how many cells are damaged before it goes through the 3 phases of healing? 1. It starts with 1 cell. The question is it subthreshold or not? And the real problem isn't if it's subthreshold or not. Most of the time, the problem is you have not been doing the sensitivity testing to find the injury, such as only paying attention to gross range of motion, and that's it. Not paying any attention to overpressure or joint motion. You missed the vast majority of that injury just because you did not do sensitivity testing. So that's the second degree. The third degree of an injury is anatomical failure. So there's subthreshold, doesn't affect you. Threshold does affect you, needs treatment, 3 phases here. And then there's anatomical failure. Anatomical failure. Quantity or quality of injured cells affect functional capacity. Range of motion, strength, sensation, bowel markers, sensitivity, mostly require treatment. 3 phases of healing are vital for the full return of functional capacity. High degree of impairment or disability. High degree. Third degree. So these are just ways of thinking about an injury. First degree, second degree, third degree. Is it subthreshold? Are you doing the sensitivity markers to find it and document it? And then you go into, definitely anatomical failure and more of an injury. And now you've definitely put them through the 3 phases of healing, 3 phases of treatment. Pay a lot of attention to the quantifying factors, and there's a high probability they're still going to have some degree of permanency. But what degree of permanency will they have in the low-impact soft tissue injury? The sensitivity bowel markers. They'll still have normal dermatomes, cranial nerves, reflexes, gross range of motion, and muscle strength at the end of care. What will they typically not have at the end of care with that type of injury, your soft tissue injury? They'll have pain, come and going, can become not necessarily constant, or pain with specific activities, subjective. What will they have? Hybrid. The most common hybrid findings you're going to find, we're going to have any in the range of motion. It'll be overpressure and joint motion. The neurological component, reflexes, no. Dermatomes, no. Cranial nerves, no. Muscle strength, no. Orthopedics, yes. The compression test, especially the extension and overpressure test. Those are the hybrid findings. Then you come over to the totally objective findings. What's the total objective findings? Totally objective. The number 1 is LMSI, intersegmental motion, dynamic. That's what's called a primary. And then you have 2 huge secondary 100% objective findings, but they're secondary because they're not specific. Flexion extension motion rates are what? They're sensitive, they're objective, they're sensitive, they're relevant, they're third-party trust, and they're highly specific. What are the 2 tests that are totally objective, that are relevant, sensitive, but they're not specific? Blood test. Which blood test primarily? C-reactive protein is the big one. Sometimes sedimentation rate, but not often. The sedimentation rate occurs mostly right after an injury. C-reactive protein. Why does the C-reactive protein commonly will be more positive throughout the course of treatment? How do we live our lives? We live our lives dynamically. What are we typically doing with our injuries? Re-irritating periodically or to some degree, on and off. That's what creates the C-reactive protein positive finding. So that is why it's a highly relevant, highly sensitive, but it's not specific for ALMSI, but it's highly authoritative. Same with what? Electrical synapses, the muscular firing with motion, right? Is it totally objective? Yes. Is it highly relevant? Yes. Is it high third-party trust? Yes. Is it very credible? Yes. Is it very specific? No. It's specific for muscle alone, but it's not specific for the ALMSI or altered intersegmental motion. But when you put it all together, when you put in the subjective, you put in the hybrid subjective and objective, and the totally objective, what kind of case? And now it's all based on the 3 phases of healing, and I quantify it. What kind of case do I have? I got a very good case. And that's how you do personal injury.